All right. Well, good morning, everyone. Hi, my name is Ed Graham, and I have the honor to serve as the CEO for New England Cancer Specialists. Thank you all for joining us today as we gather to celebrate an occasion that brings another ray of hope in the fight against cancer. The grand opening of the high-risk cancer genetics clinic here, right at New England Cancer Specialists. The reality, as we all know, is that cancer touches each and every one of us. In my case, it was my grandmother's, my mom, and my sister Lori. The days of simply waiting to hear your physician say the C word has been replaced with the opportunity to have greater control and influence over your health. Understanding risk factors, getting appropriate testing and screening, and choosing a healthy lifestyle is helping people avoid a cancer diagnosis or allowing for earlier detection and treatment. While I'm honored to speak for New England Cancer Specialists, the honest truth is that today is about the vision of our physician and staff leaders to create a program tailored to the unique needs of cancer survivors and those with genetic high risk for a cancer diagnosis. Our thanks to Dr. Elizabeth Dennis for joining New England Cancer Specialists to build and lead this program, and to Dr. Batelli, Claire Cody, and Leah Roberts for listening to patients and staff about the patient's needs, and for having the courage and tenacity to design and launch this exciting high-risk cancer genetics clinic. Today, we empower individuals to know their risks and take steps to reduce their cancer risk and or to assist with early detection. The High-Risk Cancer Genetics Clinic represents a further commitment by New England Cancer Specialists to meet the total needs of survivors and those at a high risk for a cancer diagnosis. Today, you'll hear from a patient with firsthand experience on the generational impact that hereditary cancers can have on a family. The story was so compelling that with her permission, we're retelling it all over New England. You'll also have a chance to hear Dr. Elizabeth Dennis talk about how serious the need here is in Maine and how our new program will set the standard for genetic services and prevention. But for right now, it's my pleasure to introduce a familiar face to many of you and to certainly all of us, Dr. Chiara Batelli, a breast cancer physician and president of New England Cancer Specialists. Dr. Batelli.
Good morning. How exciting it is to be here today for the ribbon cutting ceremony of this high-risk cancer genetics clinic. Today marks another important milestone in New England Cancer Specialists' commitment to defeat cancer and create a healthier community. Genetic counseling and testing has been an integral part of our practice for many years, recognizing the importance of cancer genetics as pertains to prevention, screening, and treatment. The High-Risk Cancer Genetic Clinic is a crucial step in the fulfillment of our vision to create a comprehensive and holistic approach to the fight against cancer, all cancers. Today, October 13, is National Metastatic Breast Cancer Awareness Day. In the middle of this Pink Breast Cancer Awareness Month, I would like to take a moment to drive awareness toward metastatic breast cancer patients, also referred as metavivors. In a study from 2006, it was reported that women with metastatic breast cancer often feel that their medical, emotional, physical, and financial needs are not properly addressed, and many of these women feel isolated and alone during Breast Cancer Awareness Month. Today I wear a green, teal, and pink ribbon here, created to one of my metavivor patients. Green represents renewal, hope, and immortality. Teal symbolizes healing and spirituality, and pink signifies the metastatic cancer originated in the breast. It is my absolute pleasure and honor to introduce you today Robin. Robin's and her family story is absolutely remarkable. It is the perfect example of the fact that cancer can be a family affair, and sometimes with unexpected turns and twists. It is evident that history does not need to repeat itself, that knowledge can empower to make life-changing decisions, choose between different treatment options, and offer additional treatment tools to optimize outcome. Her history outlines the intricacy and complexity of genetic predisposition and the importance of a program such as the High Risk Cancer Genetics Clinic that we are launching today. Finally, it gives me the opportunity to celebrate Ron, one of my male breast cancer survivors, whose story you can read in our website, to remind everyone that breast cancer is not only a female business. Robin, you are an amazing woman. Thank you for being here. Thank you from the bottom of my heart, really, of being here today and for sharing your story and your experience. Thank you.
So it is a complete honor to be here with you today and to share my story, but also to say that I can't share my story without sharing my family's story. Our story begins back when I was just 17 years old and my then sister, who was 24, was diagnosed with breast cancer. Thankfully, we caught it early. She had minimal treatment, and she began her survivorship. Fast forward 18 years, and my mother was diagnosed with triple negative. And at that time, in 2012, when she was diagnosed, it was recommended that my sister undergo genetic testing. And it came back that she was positive for the BRCA2 genetic gene. And my mother was then tested, and we found out she was not a gene mutation carrier, ironically. I come from a family of 6, my 2 parents. I'm the third daughter, and then I have a younger brother. Both my middle sister and I made the decision to get tested, and we found that we also were carriers for the BRCA2 genetic mutation. At that time, with a lot of information and the help of very talented genetic counselors, I went forward on my own path and empowered myself to take opportunity to prevent ovarian cancer risks and had surgical intervention. And I chose to be monitored for breast cancer and skin cancer at that time. So for the next 8 years, I spent time having regular MRIs each year, as well as my mammogram. Unfortunately, my mother lost her battle in 2013. And the following year, my older sister, who was diagnosed at 17, was diagnosed again with a second form of breast cancer. She's a survivor today, and we are thankful for that. With my diagnosis, I continued to be monitored. And in 2020, I heard those fateful words, "You have cancer." I think as a genetic mutation carrier, you almost expect it in a way, but you think it's not going to happen to you. Thankfully, at that point in time, I met the most talented oncologist, Dr. Chiara Batelli. And I am standing here almost 3 years to the date of my double mastectomy, speaking with all of you. So I am a survivor, I'm a fighter, I'm a mother of 2 amazing children, and the importance of genetic testing is not lost on me because of the future and what this program and what we're doing here today by opening up the high-risk cancer and genetic testing facility gives my 19-year-old daughter, who's standing here in the crowd, Emily, It gives her a future. It gives her the opportunity to have resources. It gives her the opportunity to choose prevention. It gives the 11 grandchildren and 3 great-grandchildren to my mother and father the opportunity for a future. And not only do we need to draw that attention, but shortly after I was diagnosed with breast cancer, my father was diagnosed with breast cancer. He is a survivor. So out of the 6 of us in my immediate family, 4 of us had breast cancer, 3 of us are survivors. Unfortunately, my mother is looking over all of us and made the ultimate maternal sacrifice, because had she not been diagnosed, we would not have gotten tested. And I can guarantee you, if I had not been tested and had not had the preventative methods, I would not be standing here today. I was 44 years old when I was diagnosed. The American Cancer Society suggests that you get a mammogram at the age of 50. By the time I was diagnosed, I had 2 large tumors and significant impact to my lymph nodes. I would not have celebrated my 47th birthday because I would not have found it until it was too late. So thank you all to New England Cancer for opening up this amazing and valuable operation and allowing my children to have a future. I'm forever indebted to New England Cancer. And I just want to thank you all for the esteemed honor to be here today and speak with you and to share my story.
Hi, good morning. So I'm going to sniffle a little because that was amazing, and really it embodies, Robin, everything that we do and why we're here today. So I really thank you, and I am going to, wipe my nose. I'm on camera, but I think it will go better so you don't have to hear me sniff during my little chit-chat here. Okay. So I'm Dr. Elizabeth Dennis, and I'm the medical director of the High Risk Cancer Genetics Clinic. I really appreciate this opportunity to speak with you a bit more about the details of our innovative new service here at New England Cancer Specialists. So I'm a pretty new kid here on the block. I just joined NEXT this past July. What I found very intriguing and what ultimately sealed the deal in my mind as to why I joined this practice is because when I was looking at this opportunity and speaking with leadership and staff and hearing about their vision for this program, I couldn't believe they wanted to focus. Here we are, treating people with cancer and their families, but they're very, very interested in, let's try to prevent things. Let's try to focus on early detection as well. So I'm a primary care internist by training, and I've practiced exclusively in Maine. And during this time, I've been struck with a few observations as I've cared for many people in my career who have had cancer. The first is that many Mainers seem resigned that they themselves will inevitably get cancer because someone in their family has been diagnosed with cancer, and they feel that there is nothing in their power to affect this. The second is that many people do not understand that their lifestyle may be increasing their risk for developing cancer. And by lifestyle, I mean things like diet, exercise, alcohol use, in addition to well-known risk factors such as smoking. Working as a primary care provider in rural Maine has also given me a unique perspective about this work. Primary care doctors have a lot to juggle while trying to meet their patients' needs, and even the best of the best cannot stay up to date with every new scientific breakthrough in medicine. These observations in my boots-on-the-ground experience have helped to create the vision of our high-risk cancer genetics clinic here at New England Cancer Specialists. The first part of this vision involves busting some myths. Number one, cancer is not inevitable. Knowing your family history, having genetic counseling and testing as appropriate may provide life-saving information. Robin told, she was the, what do you call that? Doesn't matter. My brain cannot remember. But anyway, she let the cat out of the bag. I mean, she's speaking this, she's living this. Number two, if you are found to have a genetic predisposition to cancer or a gene mutation, there are recommendations for more intensive testing. And this intensive screening. And this intensive screening leads to early detection, and early detection clearly saves lives. Number three, you each have tools in your individual toolboxes to reduce your risk of cancer apart from genetic information. This clinic is also designed to be a resource for the medical community. Our goal is to create an expert space to partner with patients and their care teams to ensure that people are receiving the most up-to-date, evidence-based screening given their individual situations. Our clinic is unique in this way. We do not just provide recommendations, but also take ownership by arranging for appropriate preventive testing and follow-up. Additionally, we work with people to develop and support their individual plans for wellness and lifestyle risk reduction. In conclusion, we are thrilled to offer this new service as part of our ongoing commitment to reduce the burden of cancer, ultimately improving the lives of you, our community members. Thank you again for your time and for your trust in New England Cancer Specialists. Together, we will create a healthier, more informed, and hopeful tomorrow. Thank you.
Thank you, Dr. Dennis. Thank you, Robin, and thank you, Kiara. I think you set the stage for really what our purpose is here, and actually you make it real from your description, so thank you very much. So on behalf of the physicians and leadership team, I extend our gratitude to our dedicated team, our wonderful patients and their families who've inspired us to take this exciting and innovative step. As we cut the ribbon to officially open the High Risk Cancer Genetics Clinic, we celebrate the new resources available in our community to meet the needs of cancer survivors and those with high risk for genetic cancers. Robin, would you please join me for the ribbon cutting? It's okay. Our high risk in cancer genetics program is clinic is officially open. Please.
This is challenging.
Thank you, everyone, for being here today, and we look forward to being a resource to the community and to anyone else who may have questions. Please reach out to us if there's any inquiry or any questions you may have about this program. You can reach us at newenglandcancerspecialist.com. Thank you and have a great day.